would like to introduce you to Hedger, who's a tissue viability nurse specialist. Not only is she a fantastic speaker, by the way, but she tap dances.
I hope I'm not going to disappoint you, because I'm not going to tap dance. Not yet, anyway. Okay, my project is about creating a silver standard for venous leg ulcer management. But I need to tell you there is a gold standard. And the reason I'm looking at a silver standard is there are a number of nurses that don't reach that gold standard skills. So it leaves some patients disadvantaged. I'd like to introduce you to Olive. This isn't Olive, but she didn't agree to have a photograph taken. But Olive was a very, very mobile patient. She was able to walk, go out for lunch. She was independent, self-caring, a very happy lady. But she developed an ulcer on her leg, which is the size of a penny. Now look away if you're a bit squeamish, because what happened to this small penny wound turned to a rather large one over a period of 12 months. Olive actually visited the GP surgery, and she was seen by nurses on a regular basis. But unfortunately, because they weren't skilled to gold standard, all they did was apply a dressing. Now, those of you who know, dressings don't heal wounds. So to continue with dressings and keep changing them, it wasn't actually helping the ulcer itself. This is a venous leg ulcer, and they hadn't discovered what was causing this particular wound. Unfortunately for Olive, it caused her an awful lot of pain over the 12 months she had this leg ulcer, and she had recurrent infections and had to take many antibiotics. And whereas she was this very independent lady, it became a time where she wouldn't get on the bus because someone on the bus had noticed the smell. So she felt she couldn't do that anymore. She went shopping and people noticed she was wearing bandages, the smell and exudate that was actually leaking from this wound. So she stopped going shopping. She stopped going to lunch with her friends, and that also affected mobility, which meant she then had to walk with a stick. So she became very isolated and probably very, very depressed. And for me, I want to know why. Why did we allow this to happen? From a wound that was a penny, the size of a penny, to that horrible picture you just saw. And when I looked at the services that we at her GP surgery, I found out there was no investment in wound management. And this is usually because of the no financial incentives. Unfortunately, on the quality outcome frameworks that the GPs have, wound care is included. So these patients are already at a disadvantage straight away because there is no investment. Also, there's a lot of time constraints in a GP surgery. The nurses often only have 10 or 20-minute appointments, and they're expected to do wound care within that time frame. Often wounds take an awful lot longer. There was no training opportunities because they didn't recognise wound care being a real problem. And there's also no funding put aside for these nurses to access any training that would actually improve their wound care service. The gold standard of leg ulcer care includes a dedicated leg ulcer assessment, a Doppler ultrasound, and compression bandaging for those venous leg ulcers. So these are the skills that practice nurses weren't attaining. It's not every practice nurse, there's just, I think it's about a third of surgeries in my area that don't do gold standard. This little machine, the Doppler ultrasound, is part of the problem. Because it's seen as the gold standard to do a Doppler ultrasound, there's a bit of an excuse saying, well, if a patient turns up with a leg ulcer, I can't do a Doppler ultrasound, therefore I can't do leg ulcer care. And I want to say, stop right there. It's not about what you can't do, it's about what you can do. And we need to look at these nurses who have very heightened skills and say, what is it you can do? Because you can do something. And what you can do is, or what I intend to do, is to actually look at a pathway, doing a silver standard, and perhaps do a more simplified assessment for the practitioners to do that's less time consuming, to actually get them to look at the leg and the signs and symptoms, the presenting signs and symptoms that will tell them or lead them to believe what is causing this leg ulcer. and then introduce a 2-layer support bandage. It doesn't have to be compression, it can be support, and that will hopefully halt the long-term chronic wound, so we don't get wounds as large as Olive had. So my silver standard is all about training nurses to just do something rather than nothing. And hopefully in that instance we will halt that chronic long-term leg ulcer. So what about Olive? Olive's wound that developed over 12 months actually cost £32,400. When we started the treatment, the silver standard, and put it into these support bandages, we facilitated the wound to heal within 8 months at a cost of £3,200. That leg has gone on to heal completely, and it now costs about £200 a year to keep it in a compression hosiery to prevent that happening again. So a very cost-effective service. So that's my proof of concept, and I'm now taking that forward. I'm about to start a pilot study in a surgery that's accepted me, and hopefully we'll move it on, and I will then do... that's Olive. She didn't actually flip like that, but she was extremely happy. But obviously I'm now going to take this project forward, do a pilot study, and also